Hello, everyone. I'm Dr. Lee Jong-guk from Apgujeong Oracle Dental Clinic. In today's master course, I'd like to discuss how we can manage unintended tooth movement when it occurs. So far, we've been discussing this in the same context, and today, I'd like to take a closer look at how we can actually solve this problem. Whether using clear aligners or brackets, it would be ideal if treatment progressed as planned. However, unintended situations still occur. Especially in clear aligner treatment, when treatment doesn't follow the planned movements, one cause may be an inadequacy in the initial diagnostic assessment.
Another factor is patient compliance. In clear aligner treatment, inadequate wear can result in insufficient tooth movement, making it a major variable in treatment outcomes. Similarly, bracket systems also have inherent limitations. Thermoformed aligner sheets have limitations in how accurately they fit around the teeth. There are also various biomechanical limitations we need to consider.
So understanding these inherent limitations and how to manage them is essential. Similarly, in bracket treatment, arch expansion is limited when relying solely on expansion wires. So we use auxiliary appliances or additional wires to support the expansion.
We may also add resin or place buttons. This doesn't mean that bracket treatment is inherently limited. When efficiency decreases or additional support is needed, we simply use adjunctive devices. I believe the same principle applies to clear aligner treatment. We don't receive an award just because we complete a clear aligner case from start to finish. Ultimately, to deliver the best outcome for our patients, I believe these auxiliary devices are essential.
So, I'd like to discuss what solutions we have when unintended tooth movement occurs, such as when the teeth aren't tracking well or the aligner doesn't fit properly. I'll explain this using points A, B, C, and D, so let's review them one by one. The point D is having the patient wear the current aligner a little longer. In other words, we delay switching to the next stage and allow more time for the current aligner to work. There are several possible reasons. The patient may not have worn the aligner adequately, or even with good compliance, the tooth may require more time to respond. So the first approach is to have the patient wear the aligner a bit longer. We might extend the wear time by an extra 1 to 3 weeks. The second option is to switch to a new aligner. In other words, we can rescan and order a new aligner. When we look at this option more closely, there are several possible scenarios. When the patient comes in, we notice that the aligner is not fitting properly. This is quite common around the lateral incisors. We may see vertical discrepancies, and in some cases, the aligner isn't fully seated in multiple areas. The molars show the same issue, and when this occurs, we first need to check the patient's compliance. They may not have worn the aligner adequately, and we can confirm this by examining the appliance. If the aligner looks too clean, it may indicate that the patient didn't wear it enough. So we need to check their compliance first. Honestly, if the issue is poor compliance, that's the easier situation. When the patient wears the refabricated aligner properly, the case progresses well. The real concern is when the patient did wear it properly, yet the teeth still haven't moved as planned. Here, after 3 months, although we intended to align the lateral incisors, the actual tooth movement hadn't followed the plan. Here, you can see a vertical discrepancy. This situation is very common. So, how do we manage it when a vertical gap develops? The first option is to have the patient wear the current aligner a little longer. Whether the patient has worn the aligner well or not, we can try extending the wear time. But sometimes the teeth still don't move, and in those cases, we need to identify the underlying reason. Simply rescanning and making a new aligner doesn't always guarantee movement. We need to identify the cause, and one of the most common reasons can be seen in this case. The treatment had been progressing according to the plan. This patient had been in treatment for 14 months, with some issues in the mandible. So we planned 5 or 6 steps to correct the rotation of the lateral incisors. Deliver the new aligners and then scheduled a follow-up 2 months later.
When the patient returned, the teeth looked like this. The rotational correction wasn't ideal. And since the patient wore the aligners well, compliance wasn't the issue. So our clinical judgment becomes important. So the question is, how should we proceed from here? Some clinicians may blame the appliance. But before we jump to that conclusion, we should pause and think once more about why it didn't work. We need some space in the interproximal area. This patient didn't have enough, so I performed an additional refinement to create the space.
Basically, I performed some stripping. This is where clinicians with more experience, in brackets, get confused.
Because in wire-based orthodontics, teeth can still align without creating space by involving the movement of adjacent teeth.
But with clear aligners, the movement is confined within the aligner, so situations like this are common. When this happens, we need to check whether the necessary space is available. Once we replan the case, movement often improves, so it's crucial to confirm that there is enough space for the tooth to move. Whenever a problem occurs, I recommend securing that space before making the next aligner. The second factor involves the opposing teeth.
In this case, the patient had been in treatment for over a year, yet the crowding had barely improved. The issue was that the mandibular incisors were blocking the maxillary incisors from moving inward. Timing is crucial. Mandibular space needs to be created first before maxillary movement occurs. Simultaneous movement of both arches is ineffective. So sometimes the desired tooth movement doesn't occur because of contact with the opposing teeth.
That's why it's important to check the interdental space and the opposing tooth.
I recommend solving that issue first, then taking a new scan and ordering the next aligner. Now, point B is adding auxiliary devices. There are several ways, but let me introduce a few. When a vertical discrepancy develops, one of the most common methods is using a button to help level the teeth. As shown here, the discrepancy is partially corrected. Another situation is with canines. Because of the rounded shape, they don't rotate well. Because of the rounded surface, aligners alone often struggle with the rotation.
In those cases, placing a button and having the patient insert and remove it generates a mesial in rotational force. Therefore, to further promote tooth movement, we can add a button and use elastics or other auxiliaries. In some cases, we attach the button directly onto the aligner. By pinching the aligner with this plier, we can create a button.
These specialized pliers allow us to form a button on the aligner. In some cases, when we try to upright a tipped tooth with the aligner, the occlusion can become unstable. In these cases, we can trim the aligner while it's in the mouth and use a button to pull down the lifted portion. We can add bonding material behind the trimmed section to upright the tooth. These techniques are useful in practice. But when the tooth is severely tipped, it becomes difficult to upright it with clear aligners alone. Experienced clinicians may be able to manage these cases, but in general, I find them quite difficult. The reason is that clear aligners deliver a push force, and these movements require some extrusion and root control, making them challenging to achieve with aligners alone.
In these situations, we can improve the efficiency of tooth movement by using auxiliary devices. In this case, while we keep the overall treatment in aligners, we cut this area and use a screw to help upright the tooth. This is what we call an uprighting spring, and after using it for some time, we eventually replace it. Depending on the situation, a tipped tooth can upright in about 5 months. Even achieving that can improve the efficiency of clear aligner treatment, so these auxiliaries are worth considering. In this case, the original plan showed that the teeth should have aligned here, but they didn't. The lateral incisor wasn't engaging with the aligner, so tracking failed. The problem is that when the patient keeps wearing the aligner that doesn't match the actual shape, a vertical discrepancy can develop. In some cases, the tooth may intrude unintentionally, creating a negative cycle.
So before repeating the issue caused by the same type of aligners, we should resolve it by using auxiliaries. Using auxiliaries like this, we can fix it within a month. To manage counter-reactions, you must use this aligner together, which we trim with scissors.
With iris scissors, we can trim the aligner chair side to correct the vertical discrepancy and then continue with clear aligner treatment. So this shows how auxiliary appliances can be used and aligner can be modified itself. Lastly, we can make small adjustments to the aligner using a dedicated plier. If we want to slightly rotate the tooth number 41, we can bend the aligner a bit using this plier. Adding these small convex bends to the aligner can generate forces that help upright the tooth. Using this principle, we can address this case as well. When the patient came in, the patient wanted to correct the vertical discrepancy. The existing aligner had already been planned as the final stage. We could try having the patient wear it a bit longer or simply make a new aligner.
We could also place an attachment or adjust the aligner itself. Which option we choose depends on the situation. Making a new aligner involves additional cost and waiting time, and placing an attachment requires patient consent. Considering all of this, a minor correction like this can often be handled by making a small adjustment to the aligner in this area. So in this case, I added a small inward convex bend, although it may be hard to see here, to help the teeth align. After creating the convex bend, a 2-week follow-up showed significant improvement. Due to existing attachments, I initially applied force to the lingual side first. While it would have been ideal to apply force to the buccal side as well, I simply left it with the lingual adjustment for a week, and that was enough to resolve the discrepancy. The entire issue was settled within 2 to 3 weeks. I believe this technique using dedicated pliers will be very useful in your practice.
Today, I explained problem solving in clear aligner treatment using the A, B, C, and D categories. Ultimately, accurate diagnosis and monitoring are essential.
I believe managing these issues properly can greatly improve our clear aligner outcomes.
We covered 4 main points, and building upon that with your own clinical expertise and practice can lead to better treatment results.
Please keep these points in mind, and that concludes today's session. Thank you for your attention.